right, a very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. It's so good to have you here. Thank you so much for choosing to watch MBCI TV ambapo tunabadilisha maisha by the grace of God. My name is Rachel Kahugo, and today we are having such an amazing conversation because we are talking about something that really affects 95% of us. So I'll be introducing what we'll be talking about today. But officially, karibu sana. It's so good to have you here. As I said before, is that my name is Rachel Kahugo, and today we are here for Afya Clinic on MBCI TV ambapo tunabadilisha maisha by the grace of God. And before we even get started, we'd like to know how you have been, what you're thanking God for. There's so much to thank God for, and we'd like for you to share with us, especially in this beautiful season that we are in. We'd like for you to share with us what is that one thing that you are thanking God for. So we'd like to hear from you, and for that our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, or SMS code, which is absolutely free of charge. We are live on Facebook, on MBCI TV Facebook page, and live on YouTube on MBCI TV official YouTube page. So karibu sana officially. It's so good to have you here. You are our guest of honor. Okay, now today we are talking about migraines. I'm a headache. Now we'll be talking about headaches, and then we'll be talking about migraines, because we most of the time hear people saying niko na migraine, unajua. But we like to know what you're experiencing. Is that actually migraine? Is it something that we are supposed to be concerned about? What are the symptoms? Is it something that's very dangerous? Is it alarming? We'll be talking about all that and the different kinds of headaches that we really just have. But for you to just understand what a migraine is, we have something that we've prepared for you, and that is the In History segment.
Migraine stretches back thousands of years, with some of the earliest descriptions found in ancient Mesopotamia, Egyptian, and Greek texts. Ancient physicians observed recurring head pain that struck on one side of the head, often with nausea and sensitivity to light, symptoms we now recognize as classic migraine signs. Hippocrates, 400 BCE, described visual disturbances preceding headaches, likely referring to aura, while Aristeas of Cappadocia, 2nd century CE, coined heterocrania, an early term for one-sided head pain. These early accounts show that migraines have long been a distinctive and puzzling neurological condition. In the medieval and Renaissance eras, migraine were often misunderstood or attributed to imbalances of the humors, particularly excess bile or an overheated brain. Treatments varied widely, from herbal remedies to bloodletting to aromatic therapies, but understanding remained limited. A major breakthrough came in the 17th and 18th centuries when physicians like Thomas Willis proposed that migraines might be linked to blood vessel changes in the brain. This vascular theory dominated medical thinking for centuries, influencing how migraines were diagnosed and treated well in the 20th century. Modern migraine science began advancing rapidly in the late 20th and early 21st centuries with the growth of neurology and imaging technologies. Researchers discovered that migraines were not simply vascular but involved complex interactions between the brainstem, nerves, blood vessels, neurotransmitters like serotonin and CGRP. This understanding paved the way for targeted treatments such as triptans in the 1990s and CGRP inhibitors in the 2010s. Today, migraines are recognized as a chronic neurological disorder with genetic and environmental components, and ongoing research continues to refine both prevention and treatment options.
Perfect, and that is what you have on the In History segment. And now I know that you have just like a brief of the history of migraines and headaches in general. Okay, now we have with us on set Dr. Weldon, and he'll be taking us through everything that pertains to I'm just about to say life and godliness, but today we're talking about things that concern our headaches and migraines in general and what that is. And we'd like for you to know who exactly Dr. Weldon is, so we have prepared something for you, and that is the guest intro. This morning on Afya Clinic, we delve into a condition that affects millions of people globally. Migraines. These intense, often debilitating headaches can disrupt your daily life, productivity, and overall well-being. Yet, many people still don't fully understand their triggers, treatment options, and how to manage them effectively. To help us unpack these, we are joined by a distinguished healthcare professional. Our guest today is Dr. Weldon Rotich, a highly skilled clinical officer with a Bachelor of Science in Clinical Medicine and Surgery from Kabarak University. He's also the director of Cuban Medical Center and Tumaini Medical Clinic, where he leads teams dedicated to offering quality, patient-centered healthcare. Dr. Rotich brings a wealth of practical clinical experience, especially in diagnosing and managing common and complex conditions. We are honored to have him guide us through understanding migraines, what they are, why they happen, and how you can better manage them. I'm your host, Rachel Kahugu. Perfect, and that is who Daktari is. Karibu sana.
Thank you very much.
We are so happy to have you here.
Thank you very much.
Welcome to the show.
Asante sana.
Yeah.
Yes.
Now, I hadn't really realized that it's the first time we are having you on set. Thinking we've had discussions on we should talk about these, kuja kwa set, we need to talk about this, but I mean, God makes everything beautiful in His own time.
Amazing.
So thank you for being here today.
Asante sana.
And because I know our Afya Clinic family, they're seeing you for the very first time. As much as you've done the guest intro, tell us who Weldon is.
Thank you very much, Rachel. My name is Dr. Weldon Rotich. I am a clinical officer by profession and currently pursuing my master's degree in reproductive health at Egerton University. We've been practicing for a while in the medical field, having graduated from Kabarak University for that degree. And the field is really amazing. We are really dealing with the most fundamental issues when it comes to diseases and lifestyle of the people.
Yeah,
yes.
Yeah. It's very interesting, Doc, while we started, and I realized that you actually treated me when I was in campus.
That was 2020.
That was 2019, actually.
2019.
Yes.
Yes.
Imagine, najua imeanza kucalculate miaka zangu, but hey, yeah, that was quite some years back, and it's good that we're having this discussion now on a new level.
Yes.
And nyuma ya curtains. After this show, you will tell me, am I now living healthy? Am there things that I still need to adjust?
I will sort it out, that one.
Okay.
I know.
Asante sana. So it's so good to have you here. Today we're talking about migraines, and mostly we call them headaches in general. Utasikia tu watu wakisema, naumwa na kichwa. But before we go into that, I like to ask doctors, before starting, what's your most memorable time as a doctor? Do you have any incident that you'd remember in your line of duty that you'd say, this was memorable? Positive, negative, any?
I think the most negative thing is to lose a patient in our health, whatever we are doing. You handle a patient from day 1, day 2, day 3 to almost 1 week. That is the most depressive moment in our life. Especially, I'm not limiting any, especially for the young kids.
Yeah.
It is really embarrassing in our field to experience that kind of scenario. That is the worst experience we ever have.
Yeah.
The most fundamental thing and positive experience is to deliver a good bouncing baby. You will see like you've been having this patient from day 1 clinic, day 2, until the mother delivers. Then you see a very good bouncing, very beautiful son.
Or daughter.
That is the most amazing thing we like to do each and every time.
Yeah, that's beautiful.
Yes.
All right, now today we're talking about migraines. And as you've said, is that people call them headaches, sana.
Yes.
So in general, headaches, what are headaches?
Headache is one of the most important signs and symptoms we are using in our field. Headache is one of the most, I think every disease might present with headache. Every illness we will present with headache. For example, malaria, they will give you headache. For example, maybe typhoid, hypertensive patients, those patients with high blood sugars will present with headache. Headache is a general term which gives us a presentation of what the patient is feeling. It gives us an information. We normally call it a messenger. It gives us there is something wrong somewhere. Then we address the issue. Headache is one of neurological symptoms. That is pain in our head. But it comes with different types. Somebody will come and say, Daktari, I have an headache. But now, it is our responsibility to explore and say which type of headache are we really having. So that we can really feature on, or now we can really get a management of this patient very easily. For example, we normally have almost the most common headache in our field is what we call tensional headache. It's a generalized pain around your head. Ni kama umefungiwa karapa band, tight. That is the tensional headache. Then now we have the one we will discuss today about the migraine headache. That is one side. It can either
one side of
the either this side, we normally call it unilateral pain. Then we have now other associated headache like cluster. That is pain around your eye and the frontal face. It is most common for those people maybe with eye problem, blindness, vision. Those are the patients will present with cluster headache. Are we together? Then now the tensional headache can present because of maybe we are having a certain chronological diseases, pathological diseases. Those are now the tensional headache, apart from the migraine. Migraine come with specific signs and symptoms. Yes.
Okay. Maybe before we go into the migraine, let's talk about the, what have you called it, the pain where you feel, but you've given a very good example, the tensional?
Headache.
Tensional headache. In general.
In general.
What are usually the most common causes of this type of headache?
Those are the most common on the tensional headache is, for example, we are having a patient presenting with malaria. He or she will present with a tensional headache. It actually deals with the pathological diseases. High blood pressure, tensional headache. Our patient with diabetes, tensional headache. Other related symptoms like high blood loss will present with tensional headache. Like we have a severe cases of anemia. Our patient will present with tensional headache. You will not get a patient with anemia presenting with migraine. So it will be a very specific thing you need to escalate. Yes.
Okay. People talk about stress. The stress causes the tensional headache.
It is there in migraine. Purely. Okay.
Now you've mentioned about the tensional one, about the one that's caused by, especially for the people who have eye problems.
Yes.
For that kind of headache, like it's but the front side of the head, is that purely for people who have eye problems?
Yes, it is more related, especially those people who are myopic. Maybe they are using sunglasses or other techniques to maybe be able to see. Yule mtu akitoa miwani, the moment anatoa miwani, anaanza experience cluster headache. So it is specific because we are dealing with a certain nerve, ophthalmic nerves. We normally supply the blood to that side, to the eye. So when we're dealing with the cluster, it's purely for the people with visual problem.
Okay.
Yes.
Okay. I hear you. Now let's go to the migraine. So the migraine, is it specifically one side of the head?
Yeah, it is specific one side. We normally call it unilateral. Bilateral mean two. Uni mean one. It can affect either one side or this side. Along here. Attacks you on that side. So it's a neurological pain which normally affect one side of the head.
Okay. Yes. What is the cause of migraine?
The causes of this migraine, we normally have a lot of risk factors which are associated with the migraine. For example, the one you first see, stress. hormonal changes. For example, menstruational cycle in our women.
Yeah.
That is one of the most. Number two, we normally have alcohol withdrawal. Those people who are withdrawing from the alcohol will normally experience the migraine headache.
Yeah.
Number two, we've talked about the stress.
Yeah.
Environmental changes. That is when you change from maybe a lowland to high altitude areas, you will really experience that kind of a migraine headache. We also have the most common is these people with depression. Depression also has become one of the most, in fact, we are really managing in our country is about depression and mental health. Those people will present forever with migraine headache.
Okay.
And then also fatigue, which is very common.
Yeah.
I find Rachel's training here from maybe around 8 to 8 p.m. That is 12 hours.
Yeah.
At the end of the day, you will never experience the tension or headache. What will come is the migraine because of fatigue.
Okay.
And also fatigue and those people who really don't dehydrate well. Dehydration. If you're not taking water, our standards say at least 3 liters per day. Maybe I can ask you, how many liters of water are you taking?
Today?
Per day.
Per day. Yeah. Nowadays, I'm actually really trying, Doc.
How many liters?
I don't know about liters. I should try and measure by a water bottle. But I try to take at least 3 of those per day.
Fatigue and dehydration give us the migraine headache.
Yeah. Okay.
So those are the most common which we are normally experiencing in this case of migraine headache. Fatigue, stress, depression, hormonal changes, change of environment, and also stress.
Okay. Yeah. Maybe let's start with dehydration. How is that related to you having a migraine?
When we are, there is something which is very important, the neurological function of our brain. The neurological functions of our brain need fluid. We need water.
Yeah.
We need to hydrate ourselves to get ourselves so that we can get some energy. We can get to work. Our tissues need fluid.
Yeah.
If we lack this fluid in our system, we will experience some kind of headache. Because fluid, our tissues is made up of almost 70% of fluid. So in a case scenario whereby you are walking and you're not hydrating well, you will lose a lot of fluid, maybe because of long standing, sweating. There's a lot of, even when you're speaking a lot, especially you people in the media sector, you tend to swallow a lot of saliva.
Yeah.
At the end of the day, you will get dehydrated. So we need to dehydrate yourself so that we cannot get that kind of presentation in our case.
Okay. Hormonal changes. You know, well, we are talking about maternal health. We talk about hormonal changes, sana. But when you're talking about migraines and you say hormonal changes, we are thinking, to be a woman. Anything will just predispose you to having any kind of sickness.
Yes.
So how are those related?
Now, the relationship between the hormonal changes, that means we know our ladies experience the menstruational cycle every 28 days or maybe 1 month.
Yeah.
And those comes with some side effect. We are changing this hormone from this factor to this factor because it's a process.
Yeah.
Once you are in this position, then after some time, your body is responding to a change of an hormonal activity. For example, menstruational cycle or menstruational activity. Your system will be interfered. And the most corresponding thing will be all the other systems from your brain will be communicated. There is an hormonal changes, activities which is happening. Maybe this person is conceiving. Maybe this person is about to experience the menstruational dates. At the end of the day, there will be a signal between the nerve systems and the hormonal activities. And the person will experience some kind of change in the system. And at the end of the day, atakwambia niko na migraine. And tutauliza, when is your date? Atakwambia ni leo. We will not treat, we just say, just understand, we are dealing with the hormonal changes.
Okay. How about fatigue?
Fatigue and dehydration is one
it's
thing.
It's the same. Okay.
You are very exhausted.
Okay.
So you need to get yourself a good rest. That is a therapy for fatigue.
Okay. We'll be talking about the treatments
and
as
by the
well.
way, I failed to mention about sleep disturbances. we have a lot of people insomnia in our field. Those who don't sleep. Atakwambia daktari silali na ninaumwa na kichwa. So one of the issues also, which is a risk factor to that matter, is not having enough sleep.
Okay. You also mentioned about alcohol.
Yes.
We hear the issue of alcohol in very many diseases, and you know, they keep saying don't take alcohol, don't take alcohol. So for alcohol, how is it related to one having a migraine?
It's so fortunate I'm a Christian. I have never tasted alcohol, but I learn, and I want to advise people to leave alcohol because it comes with severe related diseases. Not hypertension, not liver diseases, not kidney diseases. Now we will have an issue with alcohol withdrawal. We really have a problem with the alcohol withdrawal. And by the way, one of the people now we are dealing with, we are managing in our field, is a depression due to alcohol withdrawal syndrome.
Okay.
Because when you withdraw an alcohol, you are trying to cope yourself into a scenario where your chemical, we normally call it a chemical component of your system, imezoea. So there's a certain alcohol, those are ethanol. So when you introduce an ethanol into your system, you become an addict. When you become an addict, then you say, now I'm not taking any more ethanol. Your system will demand for that ethanol. And when it is not there, now you're withdrawing yourself from the alcohol. That means your system will trigger a certain migraine headache.
Okay.
Because of addiction.
Okay.
Also, what I cannot forget, those people who are using too much of caffeine.
It
is really very related with the alcohol withdrawal and addiction. When you're using caffeine, too much caffeine, and also too much, kuna kwanga na ile chakula. You normally call it cheese, too much, chocolate also is one of the things.
Chocolates as well?
Soya.
Oh, wow. Okay.
Soya na waje. It will bring you a problem with the migraine headache. So those are the most common. We are just dealing with the one which are very common in our case.
Is this the one where we hear people saying, nisipokunywa chai no mangwa na kichwa?
Like myself.
Oh, really?
I come from a tea son called Kiricho.
Oh,
so we grow up with tea every time, asubuhi chai, sasita chai. So nikitoka hii show mimi naenda kunywa chai because well, I can become very comfortable. Yes.
So that's usually it's an addiction.
It's an addiction of a caffeine.
So anytime you try to withdraw, that's where you're having a migraine headache. So what are you supposed to do if you don't? You're trying to withdraw, even as simple as just tea. For these people ambao wasipokunywa chai wanaumwa na kichwa, what are you supposed to do if you want to safely withdraw? Is it a testimony you want to give?
We normally advise people, if you are withdrawing from something, maybe for example caffeine, you do it sequentially. You don't just withdraw and then you say, from today on forth, I'm not going to take caffeine. I'll just take milk. You will have a problem. Just reduce the content, the dosage in that case. We normally call it tempering off. You just reduce. Maybe if you're taking at almost 20 milligrams, you come to 15, you come to 10, you come to 5. You withdraw systematically in a sequential manner. Fully tempering off.
Okay.
Even those who are taking alcohol, we normally advise them, you are taking this cigarette. Kama unafutanga 10, wewe futa leo 8. After next week, futa ngapi? 5. Utakuwa umemsaidia. But the moment you just stop, kesho ataenda kufuta.
Okay.
So we have a systematic way of withdrawing from these addictive substances.
Okay. Now we'll be looking at the symptoms, but before we do that, I'd like for us to just take a look at the vox pops. Now, these are some of the people that we've talked to outside, and they've told us what they think or what they know about migraines and headaches. So we get to take a look at that, and then we'll be coming right back. Sinembali.
Kulingana venye mimi nafahamu kwamba kuumwa na kichwa upande mmoja hasa huletwa na msongo wa mawazo. Na pia watu ni tofauti. Kuna labda pia mtu ako na uraibu Mwingine amezoea akinywa chai hata umwa na kichwa. Mwingine pia labda masuala ya kinyumbani tu. So in most cases msongo wa maisha ndio husababisha hiyo. Msongo wa kimawazo na pia uraibu. Mtu amezoea kitu fulani hajaitumia, pia inaweza sababisha kuumwa na kichwa kwa upande mmoja.
Labda ukiwa na stress, alafu baadhi ya watu wanasema labda kama sijakunywa chai naweza umwa na kichwa, juu ashazoea kunywa chai. Na labda kulala na side moja pia ina affect, unaweza kaumwa na kichwa. Ndio maana unaambiwa change sides, ulale na both sides. Unaweza lala na hii ingine na hii ingine. Ama ukiwa na stress mingi pia inachangia kuumwa na kichwa side moja.
Maji, kukosa maji kwa mwili. Ukikosa maji kwa mwili, hiyo ni ya kwanza. Ya pili, huyu mtu akiwa na stress itabidi roho ikipiga inapiga na kichwa hapa. Juu sasa mwili umeconnect na kichwa. Ndio maana inabidi mtu apigwe na kichwa side moja.
Kuumwa na kichwa unaweza umwa, unaweza kuwa hujakula, hujashiba, uko na stress. Kama kuna kitu yako imeibiwa, bado ni stress. Bado hata kama ulikuwa na mtu unapenda amekuacha, bado hiyo ni stress. Bado ni stress. Kwa hivyo kuumwa na kichwa ni design mingi.
So that is what we get on the Vox Pops today, and of course it's usually so good to see that people have a bit of information about the different kinds of diseases that we are talking about. Okay, and then we're going into the symptoms. What are the symptoms of a migraine, and how would you differentiate? Of course, I know we've spoken about how you know that it's just one side of the head, but how would you know that this is specifically migraine and not anything else?
Now, migraine comes with very specific presentation. Number one, we normally have what we call a severe pulsating pain. A severe pulsating pain on the one side of your brain or your head. Then it will normally have associated symptoms. When we'll be going to classifications of migraine, I'll be able to give you the presentation based on the types. Okay. But these are the most common. Nausea and vomiting, feeling dizzy, very dehydrated. Those are the most common.
Yeah.
Then for those people, you normally experience what we call phonophobia. Then photophobia. Can we differentiate? Those ones who are very sensitive to light.
Yeah.
Then we have those ones which are very sensitive to smell. Normally call it phonophobia.
Yeah.
So people just become the smell starts become an issue.
Yeah.
There is something which is coming, migraine headache, but now smell is becoming an issue.
Yeah.
When mtu akikuja hapa usikie perfume, you will not be able to get well with that perfume. Then we have eye sensitivity to too much light.
Okay.
Nausea and vomiting, the patient can feel nauseatic and wish to vomit. Those are the most common. Then very dehydrated and dizzy. Those are the most common presentation of migraine.
Or in general?
In general.
Okay.
But now when you go to classification, can I go to it?
Yeah.
When you have a classification of a migraine headache, the most common we have almost around 5 of them. We normally call migraine without aura. And then we normally have what's called migraine with aura. Then now we have the chronic migraine. For example, the migraine without aura is just a pure headache with small symptoms like nausea and vomiting. And it will not last more than 4 hours.
Yeah.
That is migraine without aura. The migraine with aura now present with neurological symptoms. Neurological mean it associates from the nerves. For example, visual disturbances.
Yeah.
A person will start feeling like there is a tingling sensation in their lower feet, numbness, then severe vomiting. And sing-song lines. Now, what is the meaning of sing-song line in Swahili?
Yeah.
So now those are neurological symptoms.
Stars. Yeah.
Those are now neurological symptoms because it presents migraine with aura. Aura is it means it comes with specific symptoms.
Yeah.
Then we have now the chronic migraine. These are migraine which normally present 15 times in 1 month.
Oh, okay. That's a lot of times.
15 times, then you monitor for 3 months. Imagine 15 times in 1 month. And then the worst thing is now, when it's present 15 times in a month, 8 times is so specific migraine. I'm saying someone will come with headache 15 times in a month. But out of that 15 times in a month, specific 8 of them will be migraine. And it lasts for almost 3 months. Those are chronic migraines. Then we now have the menstruational migraine. Those are normal. We have the cluster migraine, the one from the if you have a problem with this side of the eye, you will experience that kind of cluster migraine.
Okay.
Then we also have abdominal migraines. Then we have those patients. Abdominal migraine, someone is having an issue. For example, we have an issue with the gastric system. Maybe uko na peptic ulcer disease. Ama uko na abdominal diseases. One of the symptoms also can present with migraine. We normally call abdominal migraine.
Okay.
You have a chronic illnesses in your gastric system. Automatically, at the end of the day, we may experience a migraine headache. So when you're managing a patient maybe with gastric issues, na kuambia niko na presentation of some headache, just to know it is more related.
Okay, I hear you. Now, of course, after the break, we'll be coming back to look at the mythbusters, because you hear a lot of myths that surrounds the issues of headaches and migraines and all that. But there's something that you've mentioned, and I think that's very important to speak about while we're speaking about the symptoms. And I think this is one of the things that we like to really just assume, especially for the, is it cluster? Cluster headache, when you're having issues with that, and you just say, it's just a headache, I'll just take water and I'll be good to go.
Sure.
But how bad can it be? Would you say, especially for you umesema cluster, when you'll hear unumana kichwa, but you're straining to see, so how bad can it get? Would it affect your eyesight in long term, or ukisort to you good to go?
Yeah, for that case, when we really have such kind of a cluster headache, and I told you headache is one of the messenger that there is something wrong. Instead of addressing the issue,
we address the headache. Yes.
So when that comes in, a consistent presentation of our symptoms and you ignore, will really harm you. Because maybe there was an issue with the problem with your eye. Maybe you are losing a vision, blindness. If that symptoms yenye ulilenga kitambo ingekuwa addressed as early as possible, hatungepata hii severe damages. Begin in your retinopathy. So your retina will get damaged because of your ignorance and treating as a normal headache. So we advocate so much when you experience a kind of symptom, especially one side headache. Just look for an intervention. If there is an image need to be done, if you have a problem with your eye system, get to see the eye clinic doctors so that they can advise you. Maybe we are losing a vision.
That is one of the extremes that we've mentioned about losing vision. And that is why I think we need to be very careful with, headaches. And, I'm saying this because it's very sad. When I was a bit younger, I saw someone who actually passed on after having severe headache for like some few hours, around 8 hours. Didn't get to know exactly what happened. But, I'm just saying that we're speaking about headaches because a migraine would look like a very simple thing, but it can be very severe. Now, you've mentioned about loss of vision. What else is an extreme of headaches?
Thank you. Especially for hypertensive patients. Those people with high blood pressure. Let us be very careful. There is something, a life-threatening disease called stroke. Stroke, in fact, it is there. It is what we call hemiplegic migraine. Hemiplegic migraine, at severe stages, it will really paralyze one side of your system. We normally call it hemiplegic migraines.
Yeah.
Those are the ones patients comes with severe high blood pressure. It could almost to 30 to 80 over almost one something.
And what's the normal?
The normal, at least, let's say between 100 to 140, then 60 to 90, the lower one.
Okay.
We normally call it systolic and diastolic.
Yeah.
Then we have this patient being diagnosed for the first time. You don't know, you've been suffering with headache, and then, in fact, I have many clients of that. The one we are really diagnosing for the very first time.
Yeah.
Wanaendeanga mara moja. Kimi mara moja nauma na kichwa. Until akakuwa advice ya kwamba hii mara moja umemaliza.
Umekunya sana.
Unamaliza stop.
Yeah.
Si uangaliwe. In fact, alikuja clinic. Nikampima. Alikuwa almost around 240 over almost one something.
Yeah.
That was really, we normally call it hypertensive crisis. Hypertensive crisis.
Yeah.
At any time, we can really experience a severe stroke. We normally call it hemorrhagic stroke. Itapaswa ile mizizi ya damu. That is how you get stroke, by the way. For example, let me give you a very good scenario of how people get stroke. I know you are a farmer at some time. In our case here, our heart is one, we normally reverse the generator. Then you are irrigating a farm.
Yeah.
For our case, our heart is the generator. Our pipes are the veins and arteries which is carrying blood.
Yeah.
When you increase pressure on that generator and the pipes remain the same, what will happen? It will burst.
It will burst, yeah.
That is the same thing a stroke will be.
Okay.
It will burst and bleed.
Okay.
When it bleeds, it becomes hemorrhagic stroke. And it will really paralyze one side.
Yeah.
Ikikonga hii side, inaisha. Ikikonga hii side, inaisha.
Yeah.
Those are now the most common thing we are advising our patients to come and check themselves with the issue with the migraine headache. Because we might be dealing with stroke.
Yeah, yeah, and you don't even know.
Then you don't even know. To reverse a stroke is very expensive.
Yeah, but it can be reversed. Yeah?
Yes.
Okay, but it's very expensive.
At early stages. Severe stroke.
Yeah, that's it. Okay. Now, I'd like for us to take a very short break, and then we'll be coming right back. And it's good that we're talking about headaches and the extremes of headaches or migraines, because sometimes we get too comfortable with just taking painkillers. Maybe because we would get it through our, like, over the counter, and it's easy to get these kinds of painkillers, even the very strong painkillers, yeah. But it doesn't mean that it's now fine for you not to go to hospital. We've talked about, especially if you have high blood pressure, high blood sugar as well.
Yes, sure.
Yes, high blood pressure or high blood sugar. If you have that and you have some headaches, please make sure that you go to hospital. Sawa sawa, especially now that it's around the time of the year, yeah. Where we can be giving a lot of excuses for, just doing whatever we want to. So I pray that and I urge all of us to take good care of our health. All right? So we take a very short break. We'll be coming right back. This is Afya Clinic.
MBCI Television, transforming lives.
Nataka urudie mara tatu. Kipi kikusikitishacho? Rudie mara tatu mbio mbio.
Kipi kikusikitishacho? Kipi kikusikitishacho?
What?
Kipi kikusikitishacho?
Wacha nayo.
The cleanest part of the body ni gani?
Roho.
Eh?
Roho.
Kwa nini?
Sababu hapo ndipo Mungu anaishi.
Kimeniramba kwa kizungu?
It's about to go down.
Hiyo ni kama kitu haieleweki, ni kusema tu.
Rudia tena.
Ni kusema
At Radiance Premier Academy in Nairobi, we continue to provide education that goes beyond the ordinary. Our state-of-the-art facilities create a conducive environment for learning and personal growth. Enroll your child with Radiance Premier Academy by visiting the school at Jacaranda Close off Kiambu Road, Nairobi. Call 0701 246 971 for more information.
You don't know what you are missing.
I am not missing anything. I will talk about Jeff Kwangu. I will rather miss you and not miss God.
Tunatafuta kwa mtu anaitwa John Martins. Sijui kama unaweza kuona mtu.
Mama. Nini vile Mungu amenifanya?
Amefanya nini?
Hey.
Transform your sanctuary with high-quality church chairs designed to bring comfort, beauty, durability, dignity, and elegance to the house of worship.
Eshkol Furniture Solutions presents a church chair with a strong frame, crafted from pure virgin metal for exceptional strength and durability, and coated using high-pressure, high-temperature painting technology to resist scratches,
giving the chair a shiny, long-lasting look. This elegant and comfortable chair design comes cushioned with high-density foam, guaranteeing the comfort of every believer during church programs. Available in a wide range of colors to complement your church theme, with the option of embroidered logo for a distinguished touch of identity and elegant look. Replaceable seat covers are also available on order. The chair is built with practical functionality in mind, as it comes with an option for under-seat rack, perfect for holding Bibles, hymn books, or personal items. Its studded size saves space and allows for easy stacking, with protective plastic pads to prevent clutching. It's simple to arrange and offers flexibility for any church setup. Upgrade your sanctuary today with these premium church chairs. Prioritize the comfort of believers, beautify the sanctuary, and restore dignity of the house of the Lord.
Order today on 0757 444 333 or email us at eshkolfurniture@gmail.com. Eshkol Furniture Solutions. Passion for excellence.
At Lynette Krista Academy, we believe every child deserves a bright and confident start. Located in Lynette, Nakuru County, our school provides a safe, loving and nurturing environment designed especially for young learners. Our classrooms are full of color, creativity and excitement, where children learn through play, exploration and meaningful activities. We build strong foundations in reading, writing, numeracy and problem solving, giving your child the best possible start in their academic journey. At Lynette Krista Academy, we focus on the whole child, nurturing confidence, good manners, discipline and positive values. Here, every learner is encouraged, supported and celebrated. We also make learning fun with music, early science, outdoor play and interactive activities that help children grow socially, emotionally and physically. And for your convenience, we offer safe, reliable transport services across Lynette and the surrounding areas, ensuring your child gets to school comfortably and returns home safely every day.
A place where every child is seen, every talent is nurtured, and every voice matters.
Enroll today and give your child the joyful start they deserve. Lynette Krista Academy. A bright future begins here.
If you are looking for a school for your child, look no further. Gresta is the place to be. Thank you. And remember, at Gresta Academy, we don't just learn, we lead.
MBCI Television, transforming lives.
All right. right, we are back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is Afya Clinic because we are truly concerned with your health. Your health is a priority. All right? And here we get to talk about everything that concerns your health, of course, on MBCI TV ambapo tunabadilisha maisha by the grace of God. My name is Rachel Kahugo, and today in studio, we are here with Dr. Weldon, and we are talking about migraines. We've given a clear distinction on what exactly a headache is in general and what a migraine is. So today we are talking about migraines. Okay? Now, Doc, we've talked about the extremes of migraines. We've talked about loss of eyesight. We've talked about blood, the people who have blood pressure, so that is stroke. Yeah. Is there any other complication that would come with migraines? Persistent, for that matter.
Especially for those people, like in our clinic setup nowadays, any trauma in our head, any form of trauma, we really advocate for a CT scan or an MRI in that case. Because sometimes we normally have what you call intracranial bleeding, whereby maybe you are hit by an object or you get yourself an accident. Then you feel like everything is okay after you hit your head on the ground because of an accident. You stay at home maybe for almost 2 weeks. The issue of an headache starts, comes in now. At some time, maybe you went through some emergency care and everything was okay. You told, no, you're okay, just go home. After maybe 1 or 2 weeks, symptoms of an headache begin. Start having some headache, nausea, and vomiting. Kumbe, you caught yourself an internal head injury. Then, maybe one of the sides of your brain is bleeding. You have the intracranial bleeding. And you keep yourself ignoring. These are normal headache. After an accident, I felt it was good, nothing much. Kumbe, we are dealing with an intracranial bleeding hemorrhage. So for that matter, if you ignore the same headache, we'll get ourselves in a very bad scenario, especially for the intracranial hemorrhage, because it's a life-threatening situation. Okay. So let us be very cautious with the headache.
See to light No. Okay. Now I'd like for us to go through some of the myths and the misconceptions. But what would you say is one of the most common myths that you've heard in your line of duty concerning headaches?
I think one of the myths is that ni kama ile yangu. Nauma na kichwa. How will I phrase it? Nauma na kichwa lakini mimi najua usinitipu nikikunywa chai
itaisha. Okay. Hapa watu wenye mnapenda chai naona mmeanza kucheka.
Nikikunywa chai
itaisha. Mimi najijua, mimi uko na
hata usipime pressure. Hata usipime pressure daktari. I know this issue. This is purely tea.
It's a tea problem.
It's a tea problem.
Oh wow. Okay. Before we get into the official Mythbusters, I have some that ambazo zimetuma. So, let's go through them. So I'll just read two. Is it true that migraines only affect women?
No.
Who are the most?
But prevalence of the reason show that the most affected are women.
Okay, and why is that?
Because we are dealing women. One thing we discuss about the hormonal issue, and then most of our ladies don't know how to manage stress.
Okay.
And then also fatigue. For women, percentage is very high.
Okay.
And like men is just concentrating with the alcohol withdrawal and the rest stories.
And depression.
And depression.
Okay. I see I'm a good student here. Now, do migraines mean that one is weak or stressed?
Yes.
Oh, okay. So a migraine would actually say that you're either weak or stressed. But weak, while you're talking about weak, what are you talking about?
Weak
Yeah.
When you have a conversation about weak, that is general body weakness. Especially for a dehydrated patient. Atasikia very weak.
Okay.
So at the end of the day, if you are very weak, general body weakness, malaise, and then you have now stress.
Okay. All right, and now let's get into the mythbusters. Now with the mythbusters, you get to look at some of the myths and you get to demystify which is right and which is not. Yeah, and the first one is that only women get migraines. I know this we've talked about. Yeah, it's both for men and women.
Yes.
Yeah, but women wakona sana, especially because of the hormonal issues
and everything.
Yeah, or to be a woman. And the second one is that migraines are caused only by stress.
Not true. We discussed so many varieties that causes migraine.
Okay. And the other one is that caffeine can always make migraines become worse.
Yes, very true.
Always. Oh, okay. So don't...
Especially for addicted people.
Okay. Okay. But then that means that usi overdo. Yeah. An extreme of anything becomes poisonous, yeah?
Sure.
Okay. Well, you're talking about caffeine. What exactly are we talking about? What are the different kinds of products ambazo ziko na caffeine and people just drink? In general. Yeah.
I think caffeine is so specific. It contains what components? The caffeine?
Caffeine? That we'll have to check.
Yeah. You need to check caffeine contain what kind of content inside. Because now caffeine is coming with a lot of I don't know whether there's a mixture of chocolates, there's a mixture of ivory, tea. What do we mean? We'll check on that.
Yeah. Okay.
But caffeine really affects our brain.
Yeah. So that is tea, coffee, alcohol. What else?
Tea, alcohol, and there are other drug substances.
Drug substances.
Like nicotine, heroin.
Okay. Okay.
Na wale wanajidunga clue.
Okay. I hear you. And that is
wanajidunga ama wana sniff? I think wana sniff.
Wana sniff glue. Yeah. Okay. And the fourth one is that you can push through a migraine. Is it true?
You cannot.
It has to be treated.
Until you sort yourself the risk factors. It's an issue with alcohol withdrawal, stress management, sleep well.
Dehydration.
When you are changing an environment, what are you supposed to do? Then dehydration.
Okay. That is why some people just take water na inakuwa sawa.
If now maybe the cause of that headache was a dehydration. When you take water, it becomes good.
Yeah.
If you have a problem with the sleep disturbances, you sort yourself a good rest, you become good.
Okay. Now, for a doctor, how are you able to diagnose that this is a migraine?
We diagnose a migraine because of presentation. We take a very clear history of our patient. Presentation. We don't rush to make a decision, this is a migraine headache. It comes with various presentations. So when you are clerking our patients, we really want to listen, how does it present, how does it come, so that we know this is purely a migraine headache. At an advanced stages, we normally send patients for lab works, for imaging, for maybe central nervous system review, so that we can see, are we really dealing with a migraine headache, or maybe we're dealing with a meningitis in that case. Maybe you're dealing with hypertension in that case, or hypotension in that case. So we really want to figure out our history is what gives us the diagnosis and presentation.
Okay. Do we have other diseases that present like a migraine?
Other diseases which might really be present.
Yeah, that one might misdiagnose without, if you're not very careful.
If you're not very careful, the one maybe it can present with migraine headache is if you have an injury, a prolonged injury, other related condition like what do we call these diseases? The one for the cluster headache. It really confuses a lot of people. Because cluster headache, we are dealing with the eyesight.
Yeah.
Then you will assume and say it is just a migraine headache, and kumbe ni cluster.
Okay.
You're dealing with the eye.
Okay.
It affects one side, then you say, no, this is a cluster, this is a migraine headache. Yet it's a cluster.
Yeah.
Headache.
Yeah. Okay.
There's also one which you call occipital headache. Normally affect this side. That's occipital.
Okay.
Lakini hizi pita katikati, only one side.
Okay.
Because of our ears.
Ears. Oh, okay.
For those patients when you are going to discharge, come skew.
Okay,
Yes.
I hear you. Now, I'd like for us at this juncture to get a segment, and this is healthy living, and this just teaches us on how to live healthy on different areas of our health. Yeah, it has been prepared by the one and only Sylvia Wanja. So we get healthy living, and then we'll be coming right back as you wind up.
Hello and welcome to Healthy Living right here on Afya Clinic. Today, we are talking about a condition that affects millions of people worldwide and is one of the leading causes of missed work and school days, migraines. Now, a migraine is more than just a bad headache. It is a neurological condition that can cause severe throbbing pain, often on one side of the head. Many people also experience nausea, vomiting, and extreme sensitivity to light and sound. A migraine attack can last anywhere from a few hours to even 3 days. What causes migraines? Doctors believe they are triggered by changes in the brain and the blood vessels around it, but there are also certain common triggers that many people share. These include stress, hormonal changes, skipping meals, lack of sleep, certain foods like cheese, chocolate, and processed meats, bright lights, or strong smells. The good news is that migraines can be managed. Here are some healthy habits that can help reduce the frequency and severity of attacks. 1. Keep a routine. Maintain regular sleeping and eating schedules. 2. Stay hydrated. Dehydration is a big trigger. 3. Identify your personal triggers. Keep a small diary to track what you ate, how you slept, and what you were doing before an attack. 4. Manage stress. Techniques like deep breathing, stretching, and short walks can calm your system. 5. Limit screen time. Take regular breaks to avoid eye and brain strain. Lastly, medical treatment. Pain relievers can help if taken early. For severe cases, doctors may prescribe medication that prevents migraine or eases the severity. If you find yourself having migraines more than twice a month, it is very important to see a healthcare provider. And when should you seek help? Seek medical attention if your migraine lasts more than 72 straight hours, your vision changes suddenly, and you develop weakness or trouble speaking, or if the headaches become more frequent or severe. These could be signs of a more serious problem. Migraines don't have to control your life. With the right lifestyle, habits, identifying triggers, and proper treatment, many people live full, active, and pain-free days. That's it for today's Healthy Living segment on Afya Clinic. I am Faith Mwema, reminding you that taking care of your health starts with understanding your body.
All right, we are back, and of course, thank you so much, Wanja, for that particular segment. Now we're talking about management and treatment. How is a migraine treated?
A migraine treatment in this case is that we treat based on the cause. We need to correct the risk factors. For example, we normally have the preventive treatment, then we have the actual treatment.
Yeah.
If in that matter we are dealing with, for example, the one you've mentioned, we're dealing with stress management, we deal with stress management, those are the preventive management of our migraine. We manage migraine based on the presentation.
Yeah.
Are we dealing with what? Alcohol withdrawal. So we see how best can we manage the alcohol withdrawal. Because there are some drugs we normally give our patient for the one who are withdrawing from alcohol.
Yeah.
If it has sleep disturbances, we manage sleep disturbances. Those are the preservative management. We normally call it preservative management. We are dealing with how you present. But for advanced cases like the chronic migraines, that means there are some chronological and chronic diseases which is really associated with it.
Yeah.
If it was an issue with the smell, you need to move away from highly sensitive smell, perfume, or maybe too much light, which was a issue with eye sensitivity to light. But now for chronic cases, we manage based on the chronic diseases and illness. Maybe it was an hypertension. We put you on the hypertensive medication.
You manage the hypertension.
We manage the hypertension.
Okay.
We don't manage pain. For example, when you manage pain, you lose direction.
Yeah.
For example, Rachel, I know you have a doki nyumbani, a dog in that case. When choppers comes in the mid of the night, want to steal.
Yeah.
Your doki is a messenger. Si atakuja kupweka kwa mlango.
Yeah.
That means amuka there is kuna wezi. Instead of saying wapi you need to address the wezi, unagonga doki.
Yeah.
That is what people do in this field. Wanagonga hiyo kichwa anaambia tulia.
Yeah. Yet it's
Wanagonga the messenger. Yeah,
you
need to manage the pathological cases. So in this case, we don't manage pain.
Yeah.
If our patient present with high blood pressure, we manage pressure and the pains will cause away.
Okay.
If it was an issue with the diabetes, we need to manage the diabetes.
Okay.
If it was malaria, we need to manage malaria. If it was other chronic illnesses, we manage based on presentation. We really, when patients come into my facility, we need to screen them. What are we dealing? What are really sugars okay? Is our patient malaria is okay? Any other presentation? Do you have any history of trauma that we can do a CT scan to see? Maybe we have intracranial hemorrhages, or maybe we have a fasting stroke.
Okay.
Yes.
Okay.
Yeah.
What is the kind of migraine that you encounter mostly in your line of duty?
Sorry?
What is the kind of migraine that you encounter mostly in your line of duty?
The one with I told you, the one we normally call it migraine with aura. It presents with neurological activities. You really need to see what is really happening. The one which is presenting with migraine with aura, you see there's a stress, chai mingi, ama caffeine mingi, wale watu wa alcohol, those are the one. No, alcohol will come with the sing-sang like lines, stars. But the one stress, dehydration without aura. But this one now, the most common in our field is the one with the aura. And by the way, we have a life-threatening migraine called status migraine. Status migraine lasts for more than 72 hours.
22 is long.
72 hours. Imagine having a pulsating, throbbing pain for the next 72 hours, non-stop.
Even 1 hour is already long enough.
Yes. So those are the people we come and give them the severe analgesic painkillers. Lakini I respond.
Okay. So how do you go about it if the painkillers?
Now that one need the surgical activities to review, people from the brain department to review if you have a problem with it.
Okay. Okay. Let's talk about lifestyle. What are some of the lifestyle behaviors that one is supposed to adjust to make sure that you're not getting random migraines?
Yeah, sure. That is a good question. We need to bring our lifestyles to check, especially with what we consume, especially how are we managing stress, especially which kind of medication are you using. By the way, there's some medication, especially the cancer patient, the people going chemotherapy. There's some medication, by the way, it can give you some migraine index. So when we really want to check our lifestyle, we take what are we eating, which environment are we? Are we in an environment which is giving us such kind of migraines? What kind of diet are we eating? Especially the processed meat. Also is one of the risk factors. So we need to change our lifestyle from what are we consuming, the environment we are, and the medication we are in, and not every headache is meant for a painkiller. I think our audience should capture that one.
Kwanza hiyo.
Not every
we like to
self-medicate. Not every headache unakimbia kwa duka ununue painkiller. Allow yourself to go through the normal process of examination so that we can find the root cause.
Okay. Okay. That is very important. I think it was important for us to highlight that. Now, I know this is usually a very hard balance for most of the people. Once you've taken a painkiller and you're good. And this happens for very many diseases, yeah? At antibiotics, you know the other time we were talking about antimicrobial resistance.
I saw.
And he said that you take medicine and you know, especially the antibiotics. Uko day 2, antibiotics zimewaka and you realize, I don't need this anymore.
Why do you need to
Why do I need to continue? Yet I'm okay. Now, for these migraines, once you've taken a painkiller and you're good, is it really necessary for me to still go to hospital?
It is very important. Maybe you just want to manage to ease the pain, but that is not the remedy.
Yeah.
The remedy is to find what really causes that headache. It is not normal for a person to have an headache.
Yeah.
I think that is very clear. It is not normal. So when it is not normal, that means when you take a painkiller to ease your pain, it is not a remedy.
Yeah.
The solution need now to be established. What is really causing our headache? So let me advise these people. If you have an headache and just mess one painkiller and you feel like now you're comfortable, you are just killing our plan.
Yeah.
Because number 2, utakuja kwa hospitali kama hauna ile symptoms. How will I get to manage you? Because we share ile messenger, more symptoms. Now what are we going to do?
Yeah. Okay.
So we really need to establish a patterned way. If you just want to ease pain so that you can treat the facility, well and good. But I don't advise that.
Yeah. And the two treat you.
And the two treat you, Bana.
Okay. We have a very interesting question here. Does the screen time make migraines worse?
Sorry?
Screen time. Does that make migraines worse?
Yeah, it can.
Okay.
It can really make it worse.
Okay. So reduce your screen time, usikae sana kwa simu.
Especially for those people with some issues with their vision.
Okay. Okay.
Unajua simu iko na a lot of lights and iko na everything. Unless you are controlling your brightness.
Yeah. Okay.
Especially for parents at home, they are really giving our kids simu throughout.
Apo sasa we'll need a whole conversation because I think every kid nowadays has a tablet. Throughout. Akiboeka unapewa tablet. Urelax ndo nishughulikia wageni and it's valid sometimes. But wasizoe tablet sana. Okay?
Too much screens and kama sio kwa simu wako kwa screen. I think that is what's really happening nowadays. We really need to look into that.
Now for someone who's listened to you today, what would be your parting shots for them?
This is my parting shot. Health is very important in our sector, especially in our country. It's one of the most fundamental things we need to check into because when we lose a life, it really matters to the whole country and to the whole world. We need to keep ourselves checking and screening ourselves each and every time, especially our elderly people from 40 to maybe from 40 and above. Let's
40
is becoming elderly because of what we really consume.
Okay.
At least you have a very nice you're keeping weight.
I'm trying.
Because of what we consume, by 40, 45, it become an issue. We group you as an elderly patient. Then we need to be very careful.
If 40 is elderly, we really need to eat well.
Because that's the chronic diseases will start coming in at that age. So let's maximize our facility. Let's maximize the doctors we have in our field. We will make sure you feel good. Because that is our responsibility.
Okay.
Yes.
Asante sana. Now, for the people who would want to reach you, please share your contact and tell us where we can find you, for what facilities you're in.
Thank you very much.
Yes.
We have 2 facilities which I am currently running. A facility called Tumaini Health Care Center. It's located around Rongai. We have a recent facility in Kaparak, Cuban Medical Center. We really offer you the best professional and reliable health facility, health services within our facility. When you are within Nakuru or up the country, feel free to come and visit us so that we can really make you feel good. Because your healthy is our priority. My number is 0720 514 154. Thank you very much.
Take it again, your number?
0720 514 154.
154.
Yes, welcome to Cuban Medical Center.
Amazing. And to mine as well.
Yes.
Okay. Asante sana. That has been such a wholesome discussion today. And I know that you've gotten to learn something as well from today's conversation. So I'd like for you to share this link with as many people as you can, so that they will also, you know, just get to learn something about migraines, about headaches, and maybe a random question, Doc, as you wind up. Kuna watu umwa na kichwa sana because of carbon, wakika karibu na jiko. Yeah. What kind of headache is that?
Tensional headache.
Tensional headache. Ah, okay.
You still remember the carbon hemoglobin?
Yes.
Yes, that is what normally happens.
Okay. So it blocks the oxygen?
Yes, indeed.
Okay.
And then concentrate a lot of carbon in your system. Give you a tensional round headache.
Okay. Sawa. So that is it. If you have any other question, please, we've given the contacts. You can always ask. Maybe you can text or call. Yeah, text or call, and I know that you'll get your answers. Others, thank you so much for tuning in today. It has been such a pleasure to host you while we are speaking about headaches and migraines, and I know that you've gotten something from today's conversation. Please do not miss out. We still have much more for you on MBCI TV, but of course this has been Afya Clinic. My name is Rachel Kahugo, and today's been here with Dr. Weldon Rotich. Asante sana.
Thank you very much.
God bless you. Do have an amazing rest of the day. Bye-bye.